Welcome to a video of tips and tricks when using the catheter IV catheter.
So we're just going to go over some points for your catheter IV catheters, just some general tips and tricks to help you be more successful when using these. So the first thing, when you open this up, before you go ahead and insert, you can always just pop apart and then fully seat back together the catheter. This will just help break the seal and make it a little easier to thread off during your insertion once you're ready to thread the catheter. Now when we go to insert, we obviously want to go ahead, puncture the vein. We will see the flash go up the tip of the needle here, and then we will see some blood gather down in the bottom of the hub. Once we see that, we're just lowering our angle, advancing a hair, and now we're ready to thread off the catheter. Now what's important when we go to thread this off is we really want to focus on just pushing forward on the colored part. That's going to ensure that we're just advancing the catheter and we're threading it into the vessel. A common mistake a lot of people make is the first move is that they pull back on this clear plastic part. It's part of that kind of push-pull technique that a lot of people did in the past. We want to avoid pulling back on this first because, as you can see, all that does is pull back and retract the needle. If that tip of the needle is in the vessel and you pull back on this, you're going to have a really challenging time threading the catheter. And so really be hyper focused on holding on to the clear plastic part, keeping that as still as possible, and just pushing forward on the colored part to ensure that we have that needle staying in place and we're just threading that catheter forward. We want to make sure that we are holding this over the top a little bit. If you are holding this kind of further back, you may actually run out of room with your finger, especially those with shorter fingers. You may run out of finger length in order to thread that catheter off. A simple adjustment of moving this up over the top will help give you more room and more finger space to go ahead and thread that catheter off in its entirety. Now once this is all deployed and safetied, we want to ensure that when we go to hook up our spin collar, the first thing we do is we pull that spin collar all the way back on the extension tubing. We'll then grab the hub of the IV, and you want to get a nice strong connection of the friction fit of the lure and the hub of the IV. So again, pull that spin collar back and then just push and twist and then bring that spin collar forward. This will ensure a nice sturdy connection. A common mistake a lot of people make is that they keep that spin collar a little too far forward and they loosely just kind of try to tie this on, and then there's still plenty of space. This can cause leaking. If the patient moves a little bit and rolls that spin collar, this can easily disconnect. So again, spin collar back, push forward, and then bring the spin collar forward for the most secure fitting that you will get. So when we are threading these catheters off, we want to ensure that once we start the thread of the colored part, we never ever pull back and try to recannulate this. Once we start threading forward, I call that your point of no return. If you are threading forward on this and you face any resistance at all, you should simply safety that needle and then go get another device. I know it's not the most ideal thing to hear, but any time that you are inserting these, since this is a body softening material of the catheter itself, and it's obviously a soft in general, if you're threading this off, you're now going to be threading that catheter off at an angle once it comes off the needle. If at any point you try to pull back to remanipulate the needle and the catheter, this can happen. You may actually puncture the catheter with the needle, leaving a result similar to this. So simply to avoid that, once we start threading that needle off of the catheter, or threading that catheter off of the needle, we never ever want to pull it back on. We also want to avoid keeping the needle inside of the catheter and continuing to manipulate your needle during the stick, because again, just a small, even involuntary movement can easily slide that needle forward and shear the catheter. So again, once we start threading off, that is your point of no return. If you face any resistance at all, you simply are going to safety out that needle entirely and try to float this in, or you will have to get another device.
And lastly, the catheter needle is sharper than other IV catheters, so you will go deeper much faster than you're used to, so keep this in mind when you're inserting an IV. Thank you for watching. We hope you find these tips and tricks helpful.